Thank you. This presentation is going to be recorded, so the slides and presentation will be made available after the presentation. If you have any questions, please feel free to enter those into the chat, and we will do our best to answer those questions at the end of the presentation. We'll answer any questions pertaining to tobacco-free environments to the best of my ability. If there are any questions specifically regarding the DHS 75 revision, those can be entered on the DHS 75 revision implementation page. The link should be added in the chat shortly. A few other housekeeping items, just please make sure to keep your microphone on mute so we don't have any echo or background. Feel free to turn your cameras off just so we have a little extra bandwidth for everyone to be able to hear the audio. And one other item is that this really is the second of 2 webinars focused on integrating tobacco-free policies and tobacco treatment in behavioral health environments. The first was focused on assessment and treatment of tobacco use disorders. That was held in August. The link and with the recording and PDFs for that presentation are available online. So if you were not able to join us for that presentation, I invite you to view the recording when you have some free time. So I'm going to close out our poll results and see who we have joining us today. I'll give a few seconds for people that are finishing up. Okay. So it looks like we have a good mix of people from all across the state, some representation from all 4 regions in the state and some statewide representation. We have quite a few clinical and administrative staff joining us, some representatives from the Tobacco Prevention and Control Program, and a variety of different DHS 75 services at facilities. So that's great to see. Okay. Okay, so before we get started today, I just have a quick acknowledgement that this training is made possible through partnerships with the Wisconsin Division of Care and Treatment Services and the Tobacco Prevention and Control Program, both of whom have provided support and collaboration and funding to be able to make these resources available to providers and organizations across the state of Wisconsin. Our goals for today, we have 3 primary goals. The first is to just get a brief background to understand the context and some of the benefits and outcomes of integrating a tobacco-free environment. Then we'll take time to address a few of the common questions and concerns people have up front about tobacco-free environments. And at the end, we'll take time to really work through what does the process look like? How do we integrate a tobacco-free environment? So we'll get started with our background and context. The reason that we're all here having this discussion today is that tobacco continues to be the #1 cause of preventable death and disease in the United States. While we have seen significant progress in terms of addressing tobacco use prevalence rates in the US adult population, we still see significant. Each year, tobacco kills almost 500,000 adults in the United States. That's about 1 out of every 5 deaths that's directly caused as a result of tobacco use or directly caused by the tobacco use. And this is true because tobacco can harm every part of the body. It's not limited just to the lungs, but the heart, the brain, the skin, every organ and part of the body is impacted by tobacco use. And while we have seen significant progress in terms of addressing tobacco use prevalence rates, that progress has not been seen equally across all populations. There are certain populations that experience significant disparities in terms of tobacco use. One of which is individuals who live with behavioral health conditions, either substance use disorders and or mental health conditions. And this disparity has been well documented. We can see in the chart on the screen varying levels of prevalence rates by different behavioral health conditions. I want to draw your attention to, while there are varying levels, the rate of tobacco use in any behavioral health condition is at least twice that in individuals without any diagnosed behavioral health condition. To bring this data a little bit closer to home, because this is national data, there was a study in recent years looking at the population of, due to the ongoing epidemic of opioid use disorder, there was a study looking at this particular population, specifically people who were actively injecting opioids and or stimulants and lived in rural areas of Wisconsin and surrounding regions. This study included almost 1,000 participants and found that more than 90% of people in this population were currently smoking cigarettes. So the data we see on the screen might actually be low compared to what we actually might see in certain communities. In addition to being more likely to use tobacco products, people with a behavioral health condition are more likely to smoke more heavily and experience higher levels of dependence. About 25% of adults in the United States live with a behavioral health condition, but that 25% consumes about 40% of all cigarettes in the United States that are smoked in the United States. So really exemplifying the disproportionate burden there. And not only do we see disproportionate burden in terms of consumption, but on the health outcomes and mortality, we also see those disproportionate aspects come to reality. We see here, compared to all other behavioral causes of mortality that include drug-induced mortality, overdoses, suicide, alcohol-induced mortality, homicide, motor vehicle accidents, the mortality related to tobacco is greater than all of those other causes of mortality combined. And persons with a behavioral health condition make up a significant proportion of that tobacco-related mortality. Again, about 25% of people, adults in the United States, have a behavioral health condition, but about 50% of tobacco-related mortality is in persons with a behavioral health condition. So what has caused this significant disparity? There are a variety of reasons, and it is a full conversation in and of itself, but very briefly, first and foremost, nicotine is highly addictive. Nicotine is the addictive element in tobacco products. It only takes about 7 seconds once it's inhaled to reach the brain and start that reward pathway. And cigarettes have been highly engineered products to be as effective as possible at addicting people to the product. There's also high rates of trauma in this community. I know you're all well aware of that fact and how it might impact people's access to care and access to resources, or may impact the health behaviors that they might engage in. Additionally, the tobacco industry has contributed to the disparity from some very well-documented targeted advertising and marketing. They have provided free and discounted product to specific populations, including people with a behavioral health condition. There's also been funded research that's perpetuated certain myths, such as smoking can help decrease stress, which we know is not true. Some of these myths and financial contributions have contributed to certain cultural practices, such as building in the language of having smoke breaks throughout the day, which might encourage people to engage in a behavior that they may not have previously, or are looking to gain connections with people in their environment. Historically, we know that tobacco and cigarettes have also been used as a method of reward or perhaps punishment as people move through their treatment plan, or as a way to build rapport within treatment settings. We also know, I would be remiss if I didn't mention some of the unintended consequences on behalf of tobacco prevention and control efforts. For example, we know that taxes on tobacco products will reduce the amount of cigarettes that are consumed and the number of people who are smoking. However, as a result of these taxes, there have been certain price minimizing strategies of providing coupons and discounted or free products to certain populations to attract new customers. So very briefly, we're just going to talk about some of the individual clinical level of benefits of treating tobacco use disorders. There are many potential benefits for someone in recovery, and typically our mind right away jumps to those physical and financial benefits. However, I want to challenge our thinking about why we don't consider the emotional benefits to mental health and recovery and wellness quite as frequently. We know that tobacco harms every part of the body, and this includes the brain. So similar to the way that the lungs and the heart are significantly impacted by tobacco use, the brain is also impacted by tobacco use, and vice versa. We know that the lungs and heart will start to heal themselves almost immediately in the absence of nicotine and tobacco products, and the brain too is going to start to heal itself almost immediately in the absence of the chemicals in cigarettes and the absence of nicotine. So it only makes sense then that our emotional health, our mental health, and our recovery is going to improve in the absence of tobacco products. We're not going to get into the statistics for all of that information, but very quickly, because we are talking about recovery and addiction treatment facilities in this conversation, we're just going to talk very briefly about the link between smoking and recovery. And what the evidence shows us is that co-treatment of nicotine with other substance use disorders is associated with a 25% greater likelihood in long-term abstinence from all substances. And from the other side of that, people who continue to smoke are much more likely to relapse to their other substance use disorders and to do so more quickly as well. Further detailing that information is one study completed by Weinberger et al. In 2017, who looked at the association between tobacco use and substance use or substance use disorder relapse. And this study did find that over a 3-year time period, continued smoking was associated with a 1.56 times greater odds of any substance use and a 2 times greater odds of substance use disorder relapse relative to people who quit smoking at the beginning of that time period. The study also looked at new onset smoking, so people who began to smoke relative to people who were never smokers and continued to remain abstinent. And individuals who started smoking were almost 5 times more likely to experience a substance use disorder relapse in that 3-year time period. So when we look then at how to treat tobacco use disorders, our evidence base really is detailed in the clinical practice guideline treating tobacco use and dependence. It describes the 3 important elements that are important to tobacco treatment, which really reflect our biopsychosocial model and really the reasons that people start smoking or engage in using tobacco products. When we look at the evidence-based treatment, we know that medications are important for addressing that biologic aspect, the physical addiction to nicotine. They can help reduce and minimize withdrawal symptoms that people are experiencing. We can use a behavior change program, some skills-based coaching and counseling to address the behavioral habit of using smoking or using tobacco products. And these 2 are really detailed in our first part of our first webinar that was completed in August. So again, if you're interested in these topics, I encourage you to review that webinar and the slides that are available there. But today our focus really is on the 3rd big element that our clinical practice guideline supports, and that is the systemic or social aspect. And that is really going to address how do we increase training so that we can increase access to care and provide the most supportive environment for clients who are moving through, who want to receive treatment for their tobacco use disorders. To emphasize just how important this piece is in terms of improving health and wellness, typically, interventions are focused on our health behaviors. But according to the county health rankings model, our health behaviors really only make up about 30% of our ultimate health outcomes. And tobacco use is just a small piece of those health behaviors. If we want to have a more broad impact and how we can really extend and improve quality of life, we have to also impact our clinical care, improve that access and quality of care, improve the physical environment, improve family and social support, address those social and economic factors, all of which we can do by implementing new policies and programs such as a tobacco-free environment policy. So if we are going to be focusing on that social and organizational aspect today, really important to understand what are the potential benefits on an agency or organizational level of providing tobacco-free recovery. First and foremost, we know that creating a tobacco-free environment reduces tobacco use. Evidence clearly shows that tobacco-free policies in all settings, which include treatment settings, will decrease the tobacco use. It increases the use of evidence-based treatments for smoking, and this in turn, of course, can improve overall health and wellness, not just of the individuals who are smoking, but of those around them who, as we decrease the levels of secondhand smoke and thirdhand smoke exposure. Of course, this can contribute to improved air quality, decreased risk of fire, cleaner facilities, decreased cleaning costs due to already cleaner facilities. It may increase productivity and save money due to by saving the lost wages due to productivity. In addition to some of those more tangible benefits to the organization, there might be some benefits that are not so apparent at first glance. It might be a little more difficult to measure. And those can be improving community dynamics. Many organizations might note that there tend to be a little bit of grouping sometimes between people who smoke and people who don't smoke, and there can be somewhat of a barrier or disconnect. But by enacting a tobacco-free environment, many organizations have noted that that barrier will start to come down, and it can create somewhat of a more cohesive environment where there isn't as much of grouping between people who smoke and people who don't smoke. Additionally, we look at stigma. We understand the harms of tobacco, and in most cases, tobacco is treated. Yet for some reason, we have created this understanding that it's okay for people with behavioral health condition to continue smoking when we wouldn't necessarily have that approach with someone without a behavioral health condition. So the potential to implement a tobacco-free environment helps bring up maybe some of the same standards we have in other healthcare environments, that we want to have the same standards across the board. And I would challenge you, these are just a few of the potential benefits to take a look at what potential benefits you might see for your organization. Okay, so hopefully everyone has a good background of why we're having this conversation today and why this is an important topic. Now we're going to take some time to address a few common questions and concerns people have about tobacco-free policies. Concern number one, tobacco-free environment will negatively impact client recovery. Hopefully we have already answered this question in the first section, but it's really important. So we're going to repeat it one more time, that tobacco-free policies do reduce. They are effective at encouraging people to stop their tobacco use or reduce the number of cigarettes they are smoking. In turn, smoking cessation does not lead to an increase in use of other substances, as we've already explored. Co-treatment of nicotine with other substance use disorders is associated with a 25% greater likelihood of long-term abstinence from all substances. So we see that concurrent treatment really actually enhances outcomes for recovery. Concern number two is people don't come to treatment to address their tobacco. And while most clients might not come to treatment with tobacco as their primary goal or primary concern, a majority of people actually are interested in tobacco recovery now or in the future. One particular study looked at individuals who are entering treatment for alcohol use disorder and found that about 75% of people who smoked and had alcohol use disorder reported wanting to address both the alcohol and the tobacco. On top of this, 25%, so 1 out of every 4 people actually reported that their preference was to address the tobacco more so than addressing the alcohol at the time of entry to treatment. So this might be a fairly surprising statistic. Additionally, over the treatment period, about 30% of people actually reported increasing their preference for tobacco recovery during that treatment as well. So on top of the interest clearly being there, for people who are not interested, there are going to be some people who are hesitant or have more ambivalence about their tobacco use. We know that tobacco is a key part of recovery from all substances. It can often be a paired behavior, a linked behavior, or be a trigger to certain other substances. Many alcohol-dependent smokers report greater urges to drink when they smell cigarettes, and we know this to be true for other substances as well. Concern number 3, smoking is a right and personal choice. While smoking may be a choice initially, and people choose to engage in that behavior freely, over time, we know that nicotine will start to change the structure of the brain, and that dependence and tobacco use disorder can happen after just a few cigarettes. When someone consumes nicotine, it travels to the brain, releases the dopamine and other neurotransmitters that are involved in that reward pathway and the pleasure sensation. And you're all very familiar that when the dopamine in the brain, when those levels start to drop, we're going to experience withdrawal. And this is very true of nicotine and tobacco products as well. So that dependence can happen after just a few cigarettes. In addition to in people losing their choice of whether or not they want to smoke as that dependence starts to happen, as we established, people are interested in making changes to their tobacco use. And so that choice to be able to choose tobacco recovery is another choice. Providing a tobacco-free environment is going to enable people to be able to make that choice for themselves and not feel that they have the appropriate support so that they can accomplish their goals. Concern number 4, tobacco-free recovery will challenge our clients. And absolutely, recovery is challenging. Recovery is challenging on all fronts from all substances. It is going to challenge clients. However, there are evidence-based treatments that we know are safe and effective and can help people to work through those challenges, to address those triggers and address those cues, and to help build healthy coping mechanisms. We have medications to reduce withdrawal symptoms, and skills-based counseling can enable people to develop those coping skills. And motivational interventions can help reduce some of that ambivalence and strengthen motivations people have. Providing a tobacco-free environment, additionally, is going to introduce fewer triggers so people can practice those healthy coping skills in a supportive environment. Concern number 5, facilities with tobacco-free policies will lose clients. And to be quite frank, there just is no evidence that this is true. There have been multiple studies of various states and organizations looking at how the census and admissions or early discharges were impacted, and there across the board has been no evidence that census will decrease following a tobacco-free policy. We know that people who use tobacco products are just as likely to seek treatment for their substance use disorders as people who don't smoke or use tobacco products. And concern number 6, clients will smoke when they leave our care. So a tobacco-free environment and a policy is not necessarily forcing people to be 100% tobacco-free and maintain that abstinence for their lifetime. But it's requiring people to refrain from smoking or tobacco use while they're receiving treatment, because we know it's so critical to the recovery or their mental health. This is identical to approaches we see in other settings. And for that matter, we see examples of this in behavioral health settings. If a primary concern is cocaine, we don't allow people who use, while they might not have alcohol use disorder, we don't allow them to use alcohol or cannabis while they're receiving treatment because it's so important to their recovery. Additionally, even if people don't appear to be motivated to address a particular substance, we don't refuse treatment or minimize the treatment because we don't believe that they're going to maintain that recovery or abstinence. We still provide appropriate support to help them build those healthy coping skills and work towards the goals. Okay, so part number 3, we are going to take a minute to work through that how-to, reviewing the process of how we can integrate and create a tobacco-free environment and write a policy. A few things I want to point out just to get us set and ready for this section. There is going to be a lot of information here, but just to kind of frame us a little bit, there are many examples and a lot of writing and information on these pages, but I use them as examples to demonstrate broader points. So please don't let yourself feel overwhelmed by all the details on the graphics and examples. They're just used as examples to grasp the larger picture, okay? The second point I want to make is you can see here we have an arrowed bullet point that is, most of the bullet points are just going to be dots, bullets, but there are a few throughout that are going to have arrows. We recognize that many organizations already have some form of a smoke-free or tobacco-free policy and are just looking for opportunities to make it more comprehensive or just reinforce it within the system. So I would guide you to look at the arrows. These are opportunities of how you can really strengthen policies that already might be in place, not necessarily starting from stage 0. So when implementing a tobacco-free environment policy, there are going to be 6 primary processes to establishing that policy. And you can see those 6 processes here in our graphic. Each of these 6 components are going to help enable an organization to successfully develop and implement a comprehensive policy and enable it to be sustainable and fully integrated into the organization. Each item in itself is a process rather than one specific step. So each of these processes are going to contain multiple different recommended action items that can be carried out for the duration of implementation. It's not a directly sequential process that we work through 1, 2, 3, 4, 5, 6, but they're going to be 6 big processes to help organize and provide a framework for the process. On top of this, it's not necessarily a script. These are all guidelines and recommendations. Please tailor any of this information to your needs. It is just a way to organize the framework and the process. So starting with process number 1 is to create a wellness committee. A wellness committee is a multidisciplinary team that's responsible for developing, implementing, and evaluating all wellness initiatives. You may already have a wellness committee at your organization or a group that's working on other wellness initiatives. The wellness committee is going to meet on a regularly scheduled basis to continue moving the work forward and work through some of the process evaluation. They're also going to receive and respond to input throughout the process. And you may note that it is a wellness committee rather than a tobacco-free committee. The reason that we want to include the tobacco as a part of the broader wellness committee and initiatives is that really tobacco is central to that wellness initiative. And if we want to create a policy that is fully integrated within the community, within the culture, within the organization, we don't want to be siloing tobacco as a separate. We want to provide replacement wellness activities that people can engage in. So really important to include tobacco as part of that broader whole health model that we're really all starting to use more frequently. A big action item in as you start to create a wellness committee is to find a wellness champion. While they often hold a clinical role, the champion doesn't necessarily have to be a clinician. They may emerge naturally, someone that demonstrates significant passion or interest in this area, but it may also take some prodding to find someone who is interested in this topic and being a leader in these efforts. The champion is going to be just that, a champion who leads efforts and advocates for the initiative and policy. They're ready to engage in dialogue and answer questions and navigate the challenges as they arise. As an opportunity to strengthen the policy, don't be afraid to find additional champions as you move through the work. There are likely going to be people who learn more about the work and become more invested and interested and take advantage of their support and their willingness to engage. When you are figuring out who should be on the wellness committee, take a look at how can we best represent our organization. Include various people in different employment roles, people that hold clinical roles as well as medical roles, maybe some human resources or administrative or front desk staff would like to serve on the committee. I encourage you to include clients or people with the lived experience on the committee as well. In addition to including different roles within the organization, you may also want to consider including people with varying perspectives on the policy. Not everyone needs to be 100% gung-ho ready to go about a tobacco-free environment. It's okay if people have some questions or maybe even some skepticism or potentially even opposition to the policy. That's really only going to reinforce the efforts and strengthen the policy and reinforce the fact that you are considering all perspectives when you create the policy to make sure that you're best meeting everyone's need and addressing the concerns that are going to arise. It also just demonstrates to everyone that you have included those all perspectives throughout the discussion. Process number 2 then is to draft your policy. And you might note here as well that we don't have write your policy anywhere on this slide, that it starts by drafting, and that draft starts with creating a plan. So you want to create a logic model, a timeline, a budget, create the overall plan before we start to get into the details of what is actually included in the policy. Take the time to figure out why is policy important to our agency, how does it align with our mission and values, assess what your current policy is and areas to improve it so that it's further aligned with the mission, and then define the specific goals for your agency. What are you hoping to accomplish by updating or putting in a new tobacco-free policy? For those who are not familiar, here is an example of a logic model. A logic model is used to identify specific goals and intended outcomes based off of your resources and needs. So it's going to help define the specific activities your agency wants to engage in the process based off of your inputs and resources. Then you can clarify what the intended outputs or specific deliverables are based on the activities, and will enable you to create specific outcomes. What are the short, intermediate, and long-term outcomes that you are hoping result from this policy? Again, this is just an example. Many of these outcomes and inputs are going to vary. Please tailor this information to your agency. The next piece when starting out drafting the policy, then of course, is to create a timeline. Again, a lot of information here, but 2 big points that I want to make when starting to create a timeline. The first is that this is really just demonstrating that it's not a step-by-step 1, 2, 3, 4, 5, 6. This is how we create a policy, but each of these processes are just that, processes to be carried throughout the duration of the implementation. The second piece is that you want to select a launch day early on in the process. What is the day that the policy is going to be effective? We recommend about 6 months to 9 months, potentially a year out in advance. The reason for this is that if we do it in shorter than 6 months, it might not give people adequate time to prepare and make appropriate changes in regards to the policy. And once we extend beyond 9 months, a year, we can start to lose momentum in terms of these wellness efforts. On top of this, we know that some people are going to have, it is a big change, and people are going to have concerns, fears, maybe anxieties about what it's going to look like when the policy goes into effect. So in response to this, once the policy becomes effective, we often find that those anxieties and fears don't come to fruition, they aren't realized, and those concerns can then be alleviated. So now we finally get to writing the policy. Once we've started creating our plan and have a general overview of where we would like to go, we can start actually getting the pen to paper. At a minimum, we want to include a rationale for the policy, what products and behaviors are included in the policy, who the policy is going to apply to. Does it apply to staff and visitors and volunteers, as well as clients or patients? Where are the specific agency boundaries, and include the guidelines for enforcement. This brings up some important parts of starting to bring in our decision making. There's often the question of what is the difference between a smoke-free or tobacco-free policy. A smoke-free policy is only going to prohibit the use of combustible tobacco products, such as cigarettes, pipes, and cigars. So it's really going to focus on reducing that secondhand smoke exposure, which is a very important goal. A tobacco-free environment policy, however, is going to be more comprehensive. It's going to include chew, dissolvable products, e-cigarettes, spit, smokeless tobacco, because this is really accounting for the overall health and wellness and recovery, and taking that all into account to reduce triggers and provide the most supportive environment for recovery. So it's going to prohibit the use of all tobacco products, non-FDA approved tobacco products. So that's the first of one of the many decisions that potentially your organization is going to have to make. Again, just some examples here that you may have to discuss with your organization of what to include in the policy. In this process, I encourage you to just refer back to the goals and intended outcomes and decision-making process that were established in the logic model or early on as you're assessing what your organization's mission is. Process number 3 is to communicate your policy and expectations. Share the message early. As soon as you have started creating and crafting your message, start to share that message with staff, clients, volunteers, visitors, referring providers, so that they have time to prepare, ask questions, and make appropriate changes. You want to provide clear messaging on the rationale for the policy, what are the goals for the policy and the intended outcomes, the anticipated timeline when things will go into effect, and what are the general expectations that you have of everyone at the organization. To really strengthen the communication process, you should share what resources are available for people who use tobacco products. So whether that's providing services directly at your organization, or providing referrals to the Wisconsin Tobacco Quit line, or letting people know how and where they can access FDA approved medications. You should also share how people can get involved in the process. Are there opportunities for people to help reshape the spaces or provide their input, or how can people get involved at your organization? What can they do to help? As you're crafting your message, you may want to take a look at, refer back to SAMHSA's Dimensions of Wellness. I know this is probably very familiar to all of you, but this might be helpful in exploring how tobacco and smoking is associated with each of these dimensions of wellness, and potentially look at specific activities or opportunities in each of these dimensions that can work to shape the message of how tobacco and why tobacco-free environment is important at your organization. I mentioned it's important to talk about how people can get involved and and to educate people of why tobacco-free environment is going to be taking place at your organization. So I recommend providing various educational opportunities. Some of these might be in person, some may be just fact sheets or handouts that people can use and take home or go through with their clinician, but provide educational opportunities on the history, why we see this such a significant disparity of people using tobacco products. Take time to explore individual and as a community, what are the beliefs about tobacco use and beliefs about recovery from tobacco use disorders. Explore some common myths, such as the myth that tobacco can decrease stress, and take time to explore why it is a myth, why we believe that, and what the actual research shows. And then, of course, provide that education on where people can access evidence-based treatments. A very important part of providing that education is providing opportunities for dialogue so people can get their questions answered and have their concerns addressed. It's really important to show that we're open to feedback and we want to make this process as easy for everyone. So the dialogue shouldn't be an opportunity for people to have a debate of whether or not there should be a policy. Rather, they're opportunities to discuss how can we make this as productive and easy for everyone, and everyone is able to engage and make appropriate changes for themselves in the easiest way possible. Process number 4 is to implement your policy. So again, implementation process should start early on. We want to start planning for that launch day as soon as we know what day the policy is going to be effective. Start by creating some supportive tobacco-free spaces, work on educating staff, clients, volunteers, visitors. As soon as staff feel ready and prepared to offer those cessation services that will be available, be sure to implement those as soon as possible. And you might want to consider setting up a direct referral process to the Wisconsin Tobacco Quit Line as an additional support. A little bit more information on how to create that tobacco-free space. You can start by posting some tobacco-free signage, removing any signage that designates smoking or tobacco use areas and replace it with tobacco-free signage. Remove any large items that might remind people of a tobacco-free space, such as any ashtrays or any garbage cans that might have cigarette-specific receptacles on them. And redesign some of those spaces. There may be a smoking gazebo out back. How can we create that space to support the wellness opportunities that we're looking for? So in addition to creating these new wellness spaces or creating new wellness activities, we want to start to shift the language. So while it might not be formal, oftentimes people refer to breaks as smoke breaks, and we can start to shift that language to wellness breaks or fresh air breaks, or perhaps just breaks, right? It's just a break time. We don't have to include smoke break, as that encourages people to smoke during that time. The next big piece of implementation, of course, is to train staff. It's important to have those resources available for people to treat their tobacco use disorders. So make sure that staff feel comfortable providing tobacco use disorder treatment. They know how to allow clients to access medication or provide specific behavioral counseling. This is really what substance abuse counselors and the variety of other conditions, you already are well versed in how to do this. This is what you do every day on a daily basis. So just make sure that staff feel comfortable and confident within the context of tobacco and know specifically how to talk about tobacco, and can just modify that conversation that we already use for all other substances of how to build those skills and healthy coping skills. Be sure that staff are also comfortable and confident in the benefits of treatment and the benefits to recovery of treating tobacco, and as far as creating a tobacco-free recovery space. I encourage you also to make sure that all staff have some level of training, not just clinical staff, so that this can fully integrate it within the community and the culture. And then we get to launch day. Launch day really should be a celebration. It's an opportunity for people to share their tobacco-free stories, to invite community partners, provide preview the changes to the facilities, and preview some new wellness activities. Process number 5 then is to start enforcing your policy, and this is really a very important element. We want to have clear guidelines that allow us to respond to scenarios consistently and fairly. A big piece of this is having those cessation resources available and making sure that staff feel supported and have time to practice. They have the language and have time to practice that language and responses to various scenarios and violations that are potentially going to occur. So enable staff to be able to enforce the policy and use a team-based approach. It shouldn't fall just on one individual to be enforcing the policy. As far as what the guidelines should look like, I encourage you to take a look at what the policies are in terms of using other substances on the premises and reflect that language and protocols. But overall, consequences should be escalating and progressive in nature. Initially, however, the consequences, like if someone is using a tobacco product initially, it's likely indicating that they need an adjustment to the treatment plan. Maybe they need to try a different medication or increasing medication dosage. Maybe they need to have identify new coping strategies, or revisiting what their motivations are to build new healthy coping skills. But likely initially it's going to indicate a need for adjusting the treatment plan. You might notice that we do include discontinue services or transfer to another facility. It is very unlikely that this is going to occur, that someone is going to continue to use tobacco products and continue to violate the policy to the extent that they would need to discontinue services. However, if that is the case, it's very unlikely that the individual is only violating the tobacco-free environment policy and isn't demonstrating other behaviors that aren't in line with other protocols and a productive treatment plan. And process number 6, finally, is to evaluate your policy. The policy evaluation of the policy is going to look very different based off of your goals and intended outcomes for the policy. But overall, the suggestion is to begin evaluating early on, start with that process evaluation and collect baseline data right up front, and then assess the effectiveness of the policy with some outcome and impact evaluations using both qualitative and quantitative measures. A few examples for that process evaluation can be seen here. For example, is everyone adequately aware of and prepared for the policy? Do they understand the expectations? Is everyone adequately prepared to provide treatment? Once the policy is implemented, are violations being responded to consistently and fairly? And has support been sufficient throughout the process? So receive feedback and understand if the activities are being implemented as intended, and if they're not, make appropriate adjustments. As far as outcome or impact evaluation measures, again, a variety of examples can be seen here. Find measures that are in line with your goals and intended outcomes to measure that degree to which the program is having its intended effect based off of your goals. To summarize today, just a few final tips to reiterate. As people are creating tobacco-free environments and writing tobacco-free policies, is to make sure that the policy is tailored to the setting and organizational culture, be consistent with the policies and procedures that are already in place. We don't want to have new language that is going to be confusing for people, but if we can be as consistent as possible, it's really going to help with that seamless integration and implementation. Start by disseminating the messaging and resources as soon as possible. As soon as staff feel comfortable providing that treatment, enable them to provide treatment for tobacco use disorder in advance of the policy change day so people can make appropriate changes and start to practice their skills. And finally, teamwork is key. This should not fall solely on the wellness champion or the wellness committee. It really is a process that inspires involvement of everyone within the organization. So if you are looking for additional information, I encourage you to take a look at the Tobacco-Free Environment Toolkit online. Feel free to scan the QR code with your phone or visit helpusquit.org for the full toolkit. There are a variety of multimedia resources there. On top of the toolkit, I encourage you to reach out to your outreach specialist if you are interested in training or any technical assistance. We're happy to walk through this process with you to answer any questions or to just figure out where you're going, what your goals are. We're happy to have a conversation. So please feel free to reach out to us by phone or email.